You're listening to the official OSAP podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Well, hello and welcome back to OSAP's podcast. I'm Michelle Lee, and I am excited to have today as our guest, the one and only Dr. David Resnick, longtime OSAP member. He's been part of our board. And let me just take a few minutes to tell you a little bit about his background. If you don't know him, you should. He is a graduate of Emory University School of Dentistry here in my hometown. And he is the founder and director of the Oral Health Center of Grady's Infectious Disease Program. He founded the center in 1991. He also serves as chief of the dental medicine services for the Grady Health System. He is president and founder of the HIV Dental Alliance, which is a not-for-profit organization of concerned healthcare providers committed to assuring access to high-quality oral healthcare services for people living with HIV disease. He also serves as chair of the AIDS Institute. Dr. Resnick has lectured and published extensively on HIV, oral health, infection control, and I can go on and on about his many recognitions and awards. But when it comes to infection control, he is one of the most respected lecturers in the field. And I have to throw it in here. I have known him most of my career and am very honored to call him friend. So welcome.
Well, thank you, Michelle. It's an honor. It's great seeing you.
Yes, it's good to see you.
And it's true. We've known each other both of our entire careers. So having this opportunity to chat is absolutely wonderful. Well, so I'm looking forward to it. Let's play Stump the Dentist today.
Yes. Well, I asked Dr. Resnick to join us today after a few weeks ago, one Saturday afternoon, because apparently I have become one of those OSAP nerd infection control people. I was listening to one of his webinars that he was doing for Henry Schein on behalf of OSAP. And as I listened to you and sharing all of these facts, I thought, I need to have him as part of our podcast because you did such a great job of giving us, the true facts and from a really great perspective. So bring us up to speed. Like, where are we now with COVID? And I do always like to tell people, we do pre-record these podcasts. So it may be a few weeks. So numbers may not be actual, but at least we know what direction we're going in.
Well, I think if you look at it from perspective, our perspective last year around this time is we were shutting down. Yes. Offices around the country were only, if we were treating anything, it was emergencies only. And so if you think about all of the progress we have made in the last year, it's truly remarkable. Where are we now? We're at sort of an interesting point. We have about 30 million cases in the United States. Regretfully, at this point, we've had over 550,000 deaths. And there are some areas like Georgia where we're actually seeing a marked reduction in the number of cases, which is very wonderful since I work at Grady Health System, a very large hospital. And when we had that January, February surge, it was really over the top out here. I know some states, some places in the country are experiencing surges right now, but we're also seeing more people become vaccinated. And so we're seeing more people adhering to the physical recommendations of wearing a mask and of doing physical distancing. I never liked it when they first called it social distancing because we're social people. So that's why seeing you, Michelle, is so great for me because we're social people. And so physically we need to stay a little bit apart, and hand washing. And as dental healthcare professionals, we know about hand washing. There's certain things that we just take for granted. I'm also really pleased on the small number of infections that have occurred in the dental community. I think that just because of OSAP getting across messages all these years and CDC keeping up on the infection control guidelines, that we were in a way prepared that we really didn't know we would be prepared for. Yes, we had bloodborne pathogens in place because of HIV disease and other bloodborne pathogens, but we really had never thought about dealing with the aerosol. And that was new for us. And so we had to make some changes. We had to change our PPE a little bit. We had to add some technologies to our programs. But all in all, if I were to say where we were last year compared to where we are today, it is remarkable. And the speed at which some of these things are occurring is truly miraculous. I've worked in HIV my whole career, and for HIV to be a chronic condition in a relatively short period of time is wonderful. But to get a coronavirus that has killed over 550,000 Americans, then to be able to vaccinate against it with 94 and 95% efficacy, to keep people out of the hospital, to develop treatments like monoclonal antibodies and remdesivir. And now you've got a couple companies working on pills that you can take. So it's absolutely miraculous where we are today. I think we should, it was really sort of funny. A Town and Country came to my house, and on the cover was my favorite entertainer, Diana Ross from Studio 54, and it said, "Remember fun, get ready to have it again." So I think that we've hit that point that if we all get vaccinated, do what we can to vaccinate others, and follow our guidelines that we have in place to protect public health, that we're going to see a much better summer, a much better holiday season, and hopefully a COVID-free 22.
Oh, there is a light at the end of this long tunnel, finally.
Finally.
Yes, finally. I'm right there with you. So let's talk about vaccines. We already know that we do, even in dentistry, there is a population, and a lot of it are the younger dental professionals, a lot of them maybe in childbearing years, who have had some hesitancy about getting the vaccine. And I think from what I've heard from dentists all over, a lot of them were quite surprised at this. What would you say to people who are having some hesitancy with the vaccine?
Well, that's actually a wonderful question and a wonderful place to start. If you look at healthcare workers in general, it's about 62% that are in favor of getting vaccinated, but it depends on where you work. If you work in a hospital setting like me, where vaccinations were made available right away, there was no problem. If you are a home health care aide, the percentage that are willing to get vaccinated drops into the 20s. So it really depends a little bit on education, a little bit on sharing your experience. So one of the things that I said, they say that the second dose, you might have some muscle aches and you might be a little tired. Well, I got my second dose on a Friday. Every Saturday, I'm tired. Every Saturday, I have some muscle aches, but I also put together 2 webinars that Saturday because I was not going to miss the Tampa Bay Buccaneers in the NFC Championship game. I had a deadline. I was going to meet it, and I was going to work my way through. Another point that you brought up, which is important, is women of childbearing age. And is there a concern there? Our research, our evidence, because there have been a lot of people who have been vaccinated or in the middle of vaccine process who do become pregnant or who are lactating, and it doesn't impact fertility, it doesn't impact childbirth, it doesn't impact breastfeeding. All of those things are fine. It is perfectly safe to get this vaccine. And if you want to get back to that have fun again era, to a more normal sense of where we should be, then honestly, we have to get everybody vaccinated. There's hesitancy amongst 2 different groups. There are some minorities that have hesitancy concerns, and then there's portions of rural America that have a lack of trust in the government. And so I always want to say that, well, the government paid for that, so we paid for that. And I think we need to think that when we talk about our government, we're a representative government, we're talking about ourselves. So we as taxpayers, we paid a lot of money in advance for several companies to try to come up with these vaccines. The mRNA technology has been around now for 11 years and studied in coronaviruses. So once we had that genetic of the first variant of the virus that showed up, the genome, we were able to come up with a vaccine just like that in a heartbeat. And so those technologies are not new. And there were so many cases that you could have a 40,000 person trial and complete it in 3 to 6 months. And so when you really look at it, this was one of the easiest things to research and to look at. And the CDC has a wonderful website for reporting adverse events. And there's different ways of tracking on different health apps that are out there. So we're really only seeing a small number. The other thing that might come up is, well, is there a chance that you can get breakthrough on the vaccine? And there was a wonderful paper that will be coming out. It's not out as of this recording, from the New England Journal of Medicine, that literally talks about over 4,000 people who looked at 2 large health centers in California. Teaching schools, UCLA, UC San Diego, and they looked at these health centers, and they followed over 4,000 people 2 weeks after their second dose of vaccine, and they were doing asymptomatic testing, and only 7 out of the 4,000 actually had asymptomatic disease. So these vaccines work. And the vaccines, for the most part, are effective against the variants, especially the one that we talk most about, the B117 vaccine initially seen in the UK. The variant initially seen in the UK. That variant, which is spreading across the United States, the vaccine still works. There's no reason not to get it. We're studying these. Pfizer announced today they're looking at researching in children. Moderna has already started researching in children, so we can get everybody back to school and a new sense of normal. I mean, I do think that will we be back to the way we did our dental operations and our lifestyle operations before this pandemic? I don't know. Well, I think in the dental community, because we do now know that this virus lives in oral mucosa, it replicates in oral tissues, it's in saliva, we're always going to have to address the aerosol now. But will we be able to get some semblance of normal? We already, to a degree, have. I had my first people over for dinner in a year. It was it felt like it was a year since somebody had been over just to eat and not have to worry about having a mask on. And I love to smoke food outdoors. I love to deal around in the kitchen. And so just knowing that people can now have social time, that we can do some of our normal, I think that's wonderful. So I think we're headed in the right direction.
That's awesome. So do you think when this pandemic is done, do you think guidance will change? I mean, what's your gut on that?
Well, right now the interim guidance is still sort of saying avoid aerosol generating procedures. We've been doing full service here since August.
Okay.
But I put in the technologies that I thought were appropriate. I have extraoral aerosol evacuators, and although not scientific, I've been, as you know, I've been a dentist for a few days, and I remember that in between patients, I always needed to clean off my face shield. And so the non-scientific experiment that I had when I got my first set of these extraoral evacuators was, okay, how much splatter is showing up on your face shield? If no splatter is showing up on your face shield, then definitely no aerosol is getting there, because the suction is going to catch up that as well. And so our face shields don't get wiped at all anymore. Only thing that gets wiped is the large cone that we have. It's a huge cone, and it doesn't get in the way of performing general dental care, because I do use it, but it has enough power and enough filtration in it that I honestly think my air quality in my dental clinic is better than my air quality at home. It's absolutely remarkable. So we have a few things that we've used. We have the Aegis vac stations. That's one of my things that I really like. We have virus killers on the walls. We have Casper units. I really wanted to make sure that I have a vulnerable patient population. I wanted to make sure that we were going to do the saying I always say from OSAP, the safest dental visit.
Yes.
And that is what we do.
Oh, that is wonderful. Um, so do you think because we've all gone through this now, and as you said, I think dentistry, we were ahead of the game
Mhm.
because of the attention we paid to it for so many years. But do you think we'll be better prepared for the next pandemic? Because we know there'll most likely be another
That's
one.
Yeah, that's actually a great question. I think dentistry's ability to alter our infection control and do it in a relatively fast process has showed us there's a pathway to addressing something that's new. I can't I never thought I would be dealing with two pandemics in my career. I want to be honest. I thought HIV was enough pandemic for one human, especially when I started when there were no treatments. And
Right.
honestly, I never had a waiting list because half of my patients would pass in a year.
Mm.
So dealing with this aerosol, I think it's made us healthier people. I think our workforce will be healthier. I think if you put in all of the steps needed today, then you are prepared for the next aerosolized type of infection. And so we already have good coverage for bloodborne pathogens. And now we have even better coverage for aerosolization. And so I honestly think we'll probably be okay. I mean, I wasn't expecting this one. I'll be frankly honest. I wasn't expecting COVID-19 to take up, most of my last year and a good part of this year. That was really
Me either.
unexpected, but we were able to adjust.
Mhm.
And it took us some time to adjust. So I hope that some of the lessons learned about supply chain,
Mm.
some of the lessons learned about making sure we have enough PPE just in case, that we have enough materials to possibly make our own. Right now, there's still some people having a hard time getting N95s. And so
Which is
literally,
surprising because I'm hearing there's a lot sitting on shelves. I am hearing that from, yeah,
well,
distributors. Yeah,
we have a lot. We're doing
yeah,
fine. I have no issue.
yeah.
But some people are still complaining about having zero levels of PPD
Hmm.
or one. If you look at the ADA Health Policy
Mm.
Institute, when they're following that, there are several people who respond, they just don't have enough PPE. So it really would depend, I imagine, if you're in a big city like Atlanta, where we have good suppliers, or if you're in a more rural area where it might be more difficult to access things, or different parts of the country. And so we've, working at Grady has been a blessing because they have supported my efforts to get what is needed. And even the federal government started a COVID fund for Ryan White. So we were able to get some of this technology based on COVID funding.
Oh,
And
that's wonderful.
so it really, and honestly, I thought it was going to cost a whole lot more to get things set up, and the cost is reasonable. And there are ways to recoup your cost, I'm sure.
Right. Well, speaking of new equipment, let's talk about what you have coming down. You've been working on this new clinic,
Mhm.
and I know you've had a lot of focus on developing your whole sterilization area.
Mhm.
Share that with us. I cannot wait until I get to come tour that.
And I can't wait for you to see it. I just took a group of people up from another FQHC in Atlanta that they're building a dental clinic. I gave them a tour because I'm helping design theirs along
Mm.
with the good people from Atlanta Dental. And so, but what we have created is a hospital type setting. So
Mhm.
I use the vice, she's one of my dearest friends. Her name is Dr. Goem, Elham Goem, and she's our vice president of infection prevention. So we put our heads together and we came up with a mini sterilization center. And when I say mini, it's a 3-room suite. So you
Wow.
first go into the dirty room, which has just remarkable flooring. That's non-slip flooring in there. I did get to see that yesterday. We will have, the Mealy unit, we'll have the ultrasonic, a little pass-through window. And then we go to our first clean room. It's called clean. It's not clean to me because it's not been sterilized, but it's clean. And where it is wrapped. And then I have a hospital grade Steris autoclave coming. So
Mm.
one of those human-sized autoclaves
Mhm.
coming that you can load on one side and unload on the other side. And we also have, the Statum and those things. And then we have our clean storage. which is where you will take your instruments out. And then to make sure the dirty room is negative pressure, the clean storage room will have a double cabinet. So the sterilization person will be able to load the cassettes from clean storage, and the dental staff, other members of the dental staff, just walk down the hall, open up the container, and take out what they need without having to even go into the sterile area. And so to get into the dirty area, it'll be flash. You'll just wave your badge, you'll go in. So it's non-touch. We have put our gloves and our masks outside of the room, so we don't have to worry about aerosol contamination. Every room will have an Aegis container. It is a 12-chair, state-of-the-art facility. And as you are aware, Michelle, very people aren't. When I first started at Grady, we started with a 4-chair, really tiny clinic. And that was in 93. And then in 97, we expanded to an 8-chair, really tiny clinic. Now we're taking up about 2/3 of a floor. And it is with our own doctor's room and resident room, because we do run a residency out of here, an incredible conference area, just a wonderful wait area for our patients. I mean, it's a new lab that we have in sight. It is just, I would guess, as far as building things in Atlanta, it's my greatest accomplishment. And I know I've been around here for a long time. And so I'm blessed to have the hospital support. And we were able to do a good deal of fundraising. But when I tried to get this open, I went to every HIV agency, every health department in town. And Grady believed in me all those years ago. And they still do, which is pretty remarkable considering I'm somewhat colorful.
Well, your passion has just shown through all of these years, and that's why you've been able to accomplish this and take care of so many people. And so maybe once this is all open, we can come in and do a little filming and share it on our YouTube channel so people can.
We would love that. We're opening right after the July 4th holiday.
Wonderful.
Yes, it's our independence from a small space to a palace on the penthouse.
Wow, it's incredible. And yes, I remember coming in when it was very tiny. Yeah, so wow, you've come a long, long way. Well, let me just wrapping it up here. Number one, thank you again for taking time out of your busy schedule to talk with us. Any closing remarks you would like to make on where we're headed? And
I think there's a couple of things. I think dentists have now been approved, and some dental students and dental residents have been approved to give vaccines.
Yes, that's
I will
great.
be actually part of the vaccine blitz we're having here in a few weeks. I do have some experience giving shots outside the mouth, so I'm looking forward to it. And also how we communicate dentists, dental hygienists, dental assistants, how we talk about our experience when we've been vaccinated, and how we got over our fears of the new technology, and how we need to get above, because there are some parts of our country where only 12 or 13% of people have been vaccinated. And really, when you look at the total numbers, we're still below 20. And so we have a long way to go. So we need to encourage people of all faiths, races, religions, political affiliations, age groups, youth, professional education, lack of it, doesn't matter. We are all in this together. And to get out of this, we all need to be in it together.
Oh, wonderful, wonderful advice. And you just kind of motivated me to have a conversation with a family member that I need to have. So
There
thank
you
you.
go.
Thank you.
My pleasure.
So, well, thank you so much for joining us. And thank you all for tuning in today. I also want to encourage you, if you're not a member of OSAP, go to osap.org and check us out. We'd love to have you. We've got a lot of exciting things coming down, a new website, new learning management system, all being launched this fall. And our annual conference will be June 2nd through the 5th. It is virtual. And so if you can't attend during those times, if you register, you'll have access to the videos for 60 days. So there's going to be some amazing speakers and amazing information. So hope you'll join us. And until next time, stay safe, everyone. Thanks.